I think one of the biggest opportunities that value-based healthcare represents to society is to create a sustainable healthcare system, to help the healthcare system to be sustainable. When we think about value-based healthcare, you have to think about the crucial part that is data. You need to create data in a consistent way. And then you have the different blocks that will help us to get to the patient. So the integration of healthcare systems, and that's where also pharma can help. And this we will need that all the dots connect, and you have very conducive environments like the Nordics where we can do this quite nicely. You will have also to utilize the data and use AI, for example, where you can use that result and refine pathways and processes. And of course, with all of this, you can do value-based pricing. If you can put all these blocks together, we will help society because we will help patients to have a better life, better quality of life, and to be empowered. So I had this great opportunity to move to Finland that in fact is one of the most conducive markets, as many of them in the Nordics, to value-based healthcare. And I think we can use Finland as a lab to other countries. Why? Because in Finland and in most of the countries in the Nordics, you will have all the blocks ready to use in terms of value-based healthcare. You have data in the biobanks, for example, you have large quantities of data, you have an integrated healthcare system, you can use AI because the data and PROs is quite constant, ongoing. You can also you can refine the processes, and you can definitely create value-based pricing, and that's what we are doing. So you have all of this together to empower patients and have impact in society. So access to medicines I have a strong commitment with access to medicines, and it's my passion. And we have worked for the few years in Takeda to increase access to medicine, especially in emerging markets. And one of the things that we have created with the same principle with the value-based healthcare was a strong partnerships with different partners, sometimes not outside the pharmas like NGOs, but also inside the pharma, with universities, with the government, with payers. And we have created, how can we go beyond medicines? How can we begin to give to the governments and to the healthcare systems in a sustainable way treatment for oncology? So this was a project that has begun with the strong partnerships, right? So we have created the Center of Excellence of Oncology. And we have begun to work with the different universities, with the other pharma, with also NGOs, with patient associations. And now this Center of Excellence is working together. The idea was to serve patients with cancer. And of course in Africa, the challenge that we have is to have the right diagnostic on the right time, to be able to bring the patient to the hospital, to treat the patient, to have resources, and to also follow up the patient. So as you can imagine, to do all of this, you need different partners in different points. So this has moved quite well. It's called the Cancer Alliance, and now they are also serving other countries in Africa, what I think is quite nicely, because in fact it was not just an individual initiative, but now is able to scale up to other parts of the continent. I think we can resume the biggest challenge as sustainability. So again, we have to create, and that's why value-based healthcare is so important, because we will need to create sustainability with the healthcare systems to be able to continue to have access to to innovative medicines. What brought me to pharma and what keeps me in pharma is this power to help patients that we have. And if you follow that, you can work in different functions in different countries, and you will always enjoy it because you have always one purpose: to help patients.